Good afternoon, students. We will wait few more minutes for the others to join.
Good afternoon, Miss.
Okay, so we will start. Do you have any doubt regarding last class?
No, Miss.
So last class we saw about the definition, about the effects and uses of hydrotherapy. Okay, so about the properties which we can use it and we will be able to get the clinical significance out of it. Then we have seen about indication, contraindication, okay, so and precautions. So today we will see how to give exercises using this hydrotherapy. So we can give stretching, strengthening and aerobics. All three exercises can be given in water. Only thing is we need to use the water property instead of any other. Okay, so for example, if you are giving stretching, so you can do a manual stretching also, but here we have something called buoyancy, that is upward thrust. So we can position the patient in such a way that this buoyancy is giving them a stretch. Okay, so for example, if you want to stretch shoulder extensors. Okay, so if you want to stretch shoulder extensors, you can make the person to be standing inside water at the neck level. Then you want to ask the person to do flexion. So in that case, the buoyancy will be giving a upward pressure, and this upward pressure will give the stretch force to shoulder extensors. Is that clear? So instead of doing a manual stretching inside water, you have to position the patient in such a way that the buoyancy is giving them the stretch. Same thing if you want to do stretching for your hip extensors, you need to position the patient inside water at the waist level. Then you ask the person to do a hip flexion. So when he does a hip flexion, automatically the hamstring will be stretched because of buoyancy. Okay, so if you want to add the stretch force, so if you feel that those stretch force are not enough and you want to add some more stretch force, then you can use some of the floaters or you can use some of the dumbbell kind of materials which will be floating in the water. So you can tie that to the extremities so that along with buoyancy, this floaters also will be giving you a additional stretch. Is that clear? Okay. So I'll show you some of the videos how to do the stretching and other things. Okay. So don't worry if you are not able to imagine. Next is like resisted exercises. Again, resisted exercises is also same thing. So you need to position them according to the muscle power, and you need to see whether you want the buoyancy to support or you want the buoyancy to give resistance. So according to that, you have to position the patient and you can make them to do the strengthening exercise. Okay, so for example, if you want to do for elbow flexion, okay, so if you want to do strengthening for elbow flexion, if the muscle power is very weak, then you position the patient in standing, then you ask the person to do shoulder flexion. So in that case, the buoyancy will be giving them the assistance. And if you want more assistance, then you can just attach a floaters along with the hand and make them to float. Okay, so make the hand to float. So this will be giving them assistance, like you are adding on more of assistance. Okay, so same thing if you want to do resistance, that is if you want to have a resistance of buoyancy. So what you can do is you can position the patient in prone lying. Then ask the person to do shoulder flexion. So when you are positioning the patient in prone lying and asking them to do for shoulder flexion, then the hand will be going against the buoyancy. Okay, so when you do against the buoyancy, that will be giving them the resistance. So the resistance can be added by adding a floater and other things. So when you add a floater and do the shoulder flexion, since it is going against the buoyancy and the floater also will tend to float, but you are trying to immerse it, this will be adding on the resistance. So you can just see manual resistance, like you can give muscle power 4 or 4 plus or 5, you can do it in this manner. Okay, so the only difference between the land and the water exercises, instead of using your manual power, we are using the buoyancy and hydrostatic pressure and other thing. That will help you to do the movement without much of straining yourself. So the therapist also will gain a lot, as well as the patient also will be gaining a lot without much of pain or without much of tension, strain to the muscle. So same thing, aerobics also can be done. Like you can perform jogging in water, walking in water. You can perform cycle, and you can perform any kind of exercise. Like even a swimming. Swimming is itself a aerobic exercise. So you can perform all those things inside water. So this will give you this aerobics, like when you are doing it in inside the water, that is like 4 to 6 feet inside water, like immersed exercises. This will be a very effective aerobic exercises. So with the help of any materials, you can make the person to go down, that is like immerse inside the water and do the exercises. So I will show you the video so that you will get a good idea about all these exercises. Then, so before entering the patient into the pool, you need to ask the person to utilize the washroom, because you know that when you're making them to be inside water, because of the hydrostatic pressure, the circulation will be increased and more amount of blood will be rushed to the kidney. So the kidney will be functioning, the kidney function will be increased. So that means the urine production will be higher. So, like the being inside water, the patient may tend to go for urination more often. So every time he cannot come out of the pool, so he might void inside. Okay, so which will be damaging the pool. So that's why better ask the person to utilize the washroom before going into the pool. Then they can just take a shower. So normally the patient will change their dress, then they will be entering into the pool. So before entering into the pool, then you can ask them to just take a shower, then come into the hydrotherapy pool. Then the patient have to definitely wait till the therapist says. So the patient, in case if he knows swimming, he should not just get into the water without the therapist knowledge. So they have to wait till the therapist informs them. So give them a strict advice or strict warning or strict instruction that they are not supposed to enter into the pool without the therapist's permission. Then after the session, so after the session, immediately when the patient is coming out of the water, they have to sit and do some breathing exercise, because when they are inside water, they might have lot of dehydration, and this will lead to lightheadedness. Okay, so the patient might feel lot of some giddiness or dizziness. So they have to sit near the pool. They can take some rest, do some breathing exercise, drink some water, then get up and walk. Again, they have to take a shower, then change their dress, and then they can walk out. So immediately from the pool, they should not just directly walk to the uh, dressing area. Okay, so they have to take some rest, have a drink, maintain their water level, fluid level in the body. Then see if they don't have any lightheadedness, then they can walk to the shower and change their dress. Exactly. So apart from this, that means apart from our exercises like stretching, strengthening, and aerobics, there are some of the techniques that we can also use. Only thing is these techniques are mixed with some other techniques like Thailand, Chinese techniques or Thailand techniques and other things. So this is not a pure physiotherapy technique, but still if you want to use, then you can use it. So we have three techniques that is called as bad result technique, Watsu technique, and Aichi technique. So from the name itself, you can find out what is the collaboration of this particular technique. So first is bad result technique. So this is a technique which was developed in Germany. Okay, so Germans developed this technique, and it was first developed at Bad Rezac in Switzerland. So this is a place name. Bad Rezac is a place name. It is in Switzerland. So since they developed there, they have named the technique with a place name itself. Here, the patient is verbally, visually, and tactily instructed to do a series of movement on a relaxation pattern. Okay, so that means they will be positioned in water, and they will be doing a rhythmic relaxation movement either in a spiral way or in a diagonal movement pattern. Okay, so this will give them a relaxation. So mainly this all three techniques are towards relaxation technique. Okay, so when they do a rhythmic diagonal movement, you might have seen in a lot of Chinese and like Thailand movies. So they will be doing a diagonal movement like the hands, the legs, everything will be going in a diagonal patterns, isn't it? So those diagonal and spiral movements will give them a relaxation. So, or in other words, we can say will be doing a stretching of the tighten muscle, and that will give them the relaxation. Okay, so that is about bad Rasak technique. The next is like Watsu. So Watsu is, it is the word means water side satsu. Okay, so this is a gentle movement along with acupressure. So when they are doing a few movement, or when they are doing some stretching and other things, they will be turned gracefully, or they will be glided gracefully by another person, and they will be hold in some of the body parts like giving acupressure. So some body parts the therapist will be giving a compression holding, and they will just rotate the person gracefully. Okay, so this rotation as well as the acupressure will give them a relaxation. Okay, so it will be giving them a deep sense of relaxation throughout the body. If you see, like if the person is floating inside water itself, will give them a deep relaxation. Okay, so water itself will be giving a deep relaxation. That's why many of us will like to go for a bath immediately after a stressful walk or stressful things. Like if you, especially if you are just lying down in the bathtub, definitely that will be giving them a good relaxation. Okay, so the same concept they have used along with the turning the patient in a spiral way or in a diagonal manners. Next is Aichi. So this is again a Chinese technique. So this was created by combining Tai Chi and concept with Saitsu. Okay, so this is like previously the water concept. Along with that, they have added this Tai Chi, and this will be giving them again a relaxation. Okay, so here what they will do is they will be combining the diagonal movements of body along with deep breathing. So that means you should not make the person to be immersed in water by when they are doing this. Okay, so along with deep breathing, the person will be along with deep breathing, the person will be doing some diagonal movements that will be giving them the relaxation. Okay, so these are the three techniques which has a collaboration with other techniques. So most of the time, all these three techniques are used only for relaxation. So you can use this for a pregnant mother or any other person who needs a relaxation. Apart from this three technique, we can do our stretching and strengthening for the patients to improve their muscle power or range of motion. Okay, so let me show you some of the things that are needed to uh, do this exercises. We almost have all these equipments available in our department. So if you are coming here, then uh, we will be able to use this, and we can do it in the swimming pool, and you will be able to experience the real hydrotherapy session. Okay, so here if you see, first this is called as, can you see?
Yes, yes.
This is called as buoyancy ring or buoyancy belt. So this one is to make the person to float in the water. Okay, so this is called as buoyancy belt or buoyancy ring. So for example, if you want to make the person to float in the water at the knee level, then you have to tie this belt at the knee level and make the person to go inside water. Okay, so this buoyancy belt will help the patient or to prevent the patient without getting immersed. So this will be giving a whenever they are standing in the water. 1 minute. Whenever you are making them or putting this buoyancy belt maybe at the waist level or at the neck level or at the zipisternal level, the person will not be immersed beyond this particular level. Okay, so that's why we use this buoyancy belt. Then next equipment is, this is dumbbell. Okay, so you can see this is called a swim bar, and this is your dumbbell. So this dumbbell is made up of the thermocol or the plastic thermocol. If you see, it is like a plastic thermocol. This will be weightless. Okay, only thing is, when the sizes keep on increasing, the amount of floating will also increase, or the ability to float in water will be increasing as the size increases. So when you do with a smaller dumbbell, then it will be much easier compared to when you are doing a bigger one. This is called as paddle kick. So if you see here, you can insert this into the ankle, okay, and you can tie it so that you will be able to walk with this, or it is used like a paddle. So it will be used, you will be able to swim like a fish with this tied in your lower legs. So this is called as kickboards. So these are called as noodles, which will be helping the patient to float in water. Okay, so this is called as noodles, which will be helping them to float in water. This is another buoyancy belt. It is called a cervical collar, which will be helping you to wrap around this neck, so that the patient head will not be immersed in water. So you can see here. So you can see here the patient using the noodles. They are trying to float in water. So you are you able to see the screen properly?
Yes, yes.
So using the noodles, you will be able to make the person to float in water in supine, in prone, or as well as in side lying. You can also use this to make the person to sit. Okay, so I'll show you. You can also may use this and make the person sit and do the exercises. So you can see, like, it will be given under the shoulder, it will be given under the pelvis to make the person sit and do the exercises for the limbs. Okay, so this is your dumbbell. So you can see here, use the dumbbell to do the exercises. So same like your normal dumbbell, you can use it, but only thing is you have to keep the buoyancy in your mind, because in dumbbell it will be against gravity, but in water it will be opposite to that, because it should be against buoyancy. Okay, so in water it will be just opposite to whatever you're doing in the land. So using the noodles also, you can ask them to do some resisted exercises. So because all these materials will be trying to float in water. So when you are doing against buoyancy, when you give the resistance against buoyancy, so buoyancy as well as the floating material will give them more resistance to do. So that's why all these materials are used for assisting or resisting. So this is dumbbells. So you can use these dumbbells to do any of active exercises or active assisted exercises, assisted resisted exercises or resisted exercises. So you can use, only thing is the direction will be changed according to the need. So here if you see, if you want to do, if you want to strengthen hip flexors, so this is assistance for hip flexors. Okay, and this is stretching for hip extensors. Okay, so this position is assisted hip flexion and stretching for hip extensors. Okay, so same like here. So this will be giving assistance for abduction, assistance for leg abduction, ABD. Okay, assistance for leg abduction. Okay, then this will be stretching for adduction, ADD. Okay, can you make it? This is for stretching for abduction, adduction. Okay, so like this. So whenever you are making the person to do inside water, you need to think about the buoyancy, how it is giving assistance and how it is giving resistance. So according to the need, you have to position the patient and tie the floating material so that you can make use of the buoyancy to the maximum. Okay. Then if you see here, this is your water walking. So this will be used for your aerobic exercises. So when you do a water walking without touching the floor, then you will be using so much of calories. Okay, so when you do it with touching the floor, it may not be that much effective. But when you do it without touching the floor, then it will be giving you the maximum effective. Okay, and this is the level of percentage of weight bearing on the leg. So when you are wearing this belt, buoyancy belt at the xiphisternal level, then only 33% of your body weight will be utilized. Okay, that means only 33 percentage of the body weight will be passing through the leg. Is that clear? If you are putting the buoyancy belt at the ASIS level, then 50% of your body weight will be passing through the legs. So for example, if you are 60 kgs of weight, so when you are walking in the land, each leg will be transferring 30 kgs. Okay, so when you are standing, each leg will be transferring 30 kgs. If you are standing in one leg, then the one leg will be transferring around 60 kgs of body weight. Okay, so same thing when you are standing in the water at the hip level, that is your ASIS level. At the hip level, then only 50% of your body weight will be transferred. That means remaining, since because there is no gravitational effect, the body will try to be very much loose, or in other words, the body will be very relaxed position because it doesn't have gravitational force. So for a 60 kgs patient, if he is standing at the hip level, so normally 30 kgs will be passing through each leg, but here only 15 kgs will be passing through the leg. That means you can imagine how the pain reduction will be. So why do you get knee pain? or ankle pain or anything, whenever your body weight is passing through the joint which is damaged, then you get the pain. If the body weight is very less, then the pain also will be subsiding. So that is the benefit of this hydrotherapy. Okay, so normally we say whenever you are looking at a obese person or a fat person, what you say, your knee is not stronger to bear your body weight. That's why you get knee pain, isn't it? So when they are over obese, compared to the normal weight, if they are too high, then the body will not, the joint will not be able to hold their body weight, and that's why it gets degenerated. That's why it will be getting pain and other things. So once the body weight is reduced, automatically their problem also will be subsided. So that one only temporarily we are doing inside the water. So temporarily, when you ask the person to do in land, the pain will be hindering their exercising capacity. So when they do some 10 times, they will get pain and they will stop the exercises. But here, since the body weight is very much reduced, they will be keep on doing the exercises very well. So that's why hydrotherapy will be more effective compared to land exercises. Okay, so in case if they are putting this buoyancy belt at the C7 level, then that means only 10% of the body weight will be passing through the leg. Is that clear? So this is the normal thing for you to understand and decide at which level you want to put the buoyancy belt. Not only this, you can also decide by using decide by uh, the body part you are giving exercises. For example, if you want to give only leg exercises, then you can put them at the ASAS level or waist level or Ziphistrana level. If you want to do for your upper limb exercises, if you want to use the buoyancy to the maximum, then you need to put them at the C7 level. Is that clear? So depending on the body weight, depending on the body weight bearing allowed. I'm sorry, I think there were some internet issues. Okay, so depending on all these things, you can decide where to put the buoyancy belt. Okay, so now I'll show you some video for your easy understanding. So this is our first video, you can watch it.
Knowing what to expect in therapy. Therapy, by definition, is all about helping us get healthy. And sometimes knowing what to expect in therapy can make it easier to get started. So today I'm checking out what aqua therapy is all about. So today I am with Jess at the Shirley Ryan Ability Lab. Now, Jess, I think we should start with talking about who exactly aqua therapy is for.
Aquatherapy is for all age ranges and all populations. Chronic pain patients, musculoskeletal, neuromuscular, which could be our spinal cord injury, traumatic brain injury, multiple sclerosis, and Parkinson's.
So I'd imagine getting in the water is actually allowing these people to move a little bit easier.
Absolutely. So the water allows a really unique environment using buoyancy and viscosity to allow both off-weighting of our joints and a decrease in pain. It's a really great way and an easy way to get moving.
They may be a little bit concerned about getting in the water. They may not know how to swim, and so they say, I don't want to get into the pool. What do you say to them?
Our pool is 4 feet around. Most people's heads will be well out of water, and so it really does allow a safe environment to exercise.
Okay, so we're gonna get in the pool.
Yes.
And you're gonna show me some exercises.
Absolutely.
It's warm. It's warm.
Yes, it's really warm.
This is my kind of pool. It's warm.
Yes, and this makes you feel more relaxed.
Yes.
And decreases pain, improves pain management. So for people who may be a little bit nervous about getting in the pool or scared of falling, we can give them a noodle to support them. This is how we typically warm up a lot of our aquatic sessions. This will allow us an increase in balance, stability, maybe also if there's a little bit less functional strength, or if we're just off-weighting our joints, opening up and increasing our range of motion in what can be a pain-free environment for a lot of people. Now we'll go over to our right and left.
Okay, good.
So we know that multi-directional walking also improves balance, whether it's in the aquatic environment or on land. We're going to try to progress this and show how we can use this as a resisted exercise as well. So I'm going to have you push the noodle down and have a seat on it. And we're going to do some aerobic exercise.
Okay.
Okay. So from here, I'm going to have you just start bicycling. Again, we can always make this easier or harder using our hands or not using our hands.
We wrap things up with some arm exercises.
Keep our arms out. And then you're going to push all the way down to your thighs, and you can even tell you're using your core.
I was just about to say, I can feel my core.
And so once we come up, let's come to maybe another one of our exercises out to the side. And we'll just push down, and now you can tell the balance is a little easier, but we're still doing a good shoulder exercise.
So Jess, I think
In this video, you can see whenever they are pushing down the dumbbell, then it will be more difficult because of the buoyancy along with this dumbbell. Okay, but when they are bringing it up, then it will be assistance. So when they are bringing it outside the surface and again they are taking inside, they have to overcome the surface tension, then the buoyancy. So 2 resistance. Along with that, if they do the dumbbell, then they have 3 resistance. Is that clear?
the biggest takeaway that we can take from aquatic therapy is that it's really an easy way to get moving and get healthy.
Yeah, absolutely. And it really captures all of our different patient ages and population. It's something that everyone can really use.
To learn how other things work in the world of health, just head to our website, livinghealthytv.com.
So let me show you one more video so that you will get little more idea about hydrotherapy. So this is called water walking. So this you can do with feet touching the floor or feet without touching the floor. So this you can see when you are doing along with buoyancy, it will be assistance. When you do against the buoyancy, it will be resistance. So same with this, you can also tie up the dumbbell or you can tie up any pedal or anything. Then that will be giving them the extra resistance or extra assistance. Is that clear? now. Um, okay, so you can see how they are giving. Okay, one more video regarding the benefits of aerobic exercise.
Been on her feet for as long as she can remember, and she'll do whatever it takes to stay that way.
My parents were active and they didn't believe in sitting around doing nothing. You had to move. We walked to school. We didn't get buses. You know, we worked hard when we were younger.
Joyce has been going to the gym since she was 12, more than 78 years ago.
I'm better off because I was active when I was young. I don't want to push a buggy. I don't want to have a walker. I would like to just stay on my feet. I have problems. I have neuropathy.
Neuropathy is caused by nerve damage and results in numbness and pain in hands and feet.
I've had it for 5 years, but I'm not giving into it.
Joyce falls into what we would call the senior population. And exercise for seniors is such a challenge. They want to exercise, but if they do something incorrectly and or have a problem with it, it does the exact reverse of what they're trying to achieve.
Through it all, Joyce has managed to stay on her feet by keeping them submerged in the water. Joyce is a regular in the aqua aerobics class at the Midtown Athletic Club.
When I was younger, I could do this stuff on the land, but now in the older age, you need a little bit of the buoyancy. You have to work hard. You have to make the commitment that you're going to do what she says and do it to the best of your ability. We laughed the entire hour. That's good for the soul. It's good for the body.
Group fitness instructor Sue Breckheimer says there are 3 main reasons aqua aerobics is ideal for anyone looking to lead a long, healthy life.
The first one is the pressure of the water actually makes your lungs work harder and makes your heart work harder. Critical for anybody, but especially the aging population. The second one would be the resistance, almost like you're lifting weights on land without having to worry about your joints. And I have to say, the social aspect of an aqua aerobics class is wonderful for everyone, again, especially for the aging population.
Aqua aerobics keeps Joyce on her feet so she can enjoy what's important, her family and friends.
You have to have friends. We go up for coffee. If you've got anything that bothers you or you need to know a doctor, you need to know something, boy, we have people that everybody can tell you something.
I think Joyce's positive outlook on life is probably the biggest inspiration to all of us in the water, and it's pretty impressive. It's pretty impressive. It's somebody I would like to be like when I'm 90.
Everybody's got something that drives them to do something. I hope it's the beginning of a lot of people that are older that they'll do stuff, you know.
For more information on aqua aerobics and staying.
Okay, so you have watched one video how this aqua therapy, that is the hydrotherapy, is helping older people. So people who are very old, because of the natural aging process, definitely they will be having a lot of degeneration in the joints. Their muscles will get wasted and they will have a lot of wrinkles around. So all these are normal aging process. So those people, when they are going for gym, they find it very difficult because of pain and reduced range of motion. So these people, hydrotherapy will be greater benefits, and this is nowadays like very common in European countries, where along with the gym they also have this hydrotherapy or a pool therapy. So where old people with any other complications also will be able to do the exercises and be fit for a longer time. Okay, so let me show you one video of how it is helping to do for a knee joint person. Okay. This is to strengthen your knee joint.
Welcome back to Active Chiropractic, guys, and today I'm going to show you some exercises you can do for your knees in the pool. Now, if you're going through osteoarthritis, or you're going to go for surgery, or if you already had surgery, even if you're pregnant, these exercises will be fantastic for you because you've got buoyancy, you've got dynamic resistance, and you've got hydrostatic pressure as well. Now, buoyancy is when you walk in the water, even if you're at waist level, 50% of your body weight is actually taken off because there's pressure from the water pushing you up. Now, dynamic resistance is the resistance of water when it presses against you when you move, and it can also strengthen your body up and your joints. And hydrostatic pressure is the pressure of the water against your joints, so pushing against the skin of your joints, so it limits lactic acid buildup and also limits inflammatory process of the osteoarthritis if you have osteoarthritis. Now, I did these exercises and I actually pulled up a little bit sore, so I can imagine you guys will get a little bit sore as well. Let's start with the easiest exercise. Pool walk. This is pretty self-explanatory. If you're having trouble doing this, especially if you just had surgery, just use the side of the pool to help you. This will build proprioception, mobility in the joints, and strengthen your joints as well. Even reduce pain and the inflammatory process in arthritis. Pool walking backwards. This will mainly work the knee extension, which is fantastic for VMO strengthening. I highly recommend this if you've got osteoarthritis and you need rehab. Side walking. This is very similar to the previous exercises. However, you're mainly working on the outside of the knee and the inside of the knee as well, which is very important to keep knee stability and very important to strengthen as well. Remember to go back and forth. Once again, start with the pool walk to help assist you, especially if you just had surgery. Jogging on the spot or knee raises. This will create motion in your knees and blood flow into your joints as well. The act of bending and extending your knees will do that, and the buoyancy of water will lessen the impact on your joints. Static squats. You basically go in the squat position, having your feet shoulder width apart, and try and lower yourself as low as possible until your thighs are parallel to the pool floor. Hold this position for about 30 seconds to a minute and focus on VMO contraction, which is the muscle just above your knee on the inner thigh. This will give you stability and strengthen your knee joints. Bodyweight squats. Assume the same position as the previous exercise and try to squat below parallel and then push yourself up. And if you can't go parallel, just go as low as possible. And if you're too short, just do it on top of a step-up box instead. This way your head won't go under the water. Leg extensions. These work on both legs. The one that keeps you balanced will gain strength and stability. Make sure you concentrate on activating your VMO muscle with your leg extended. The leg that is extended will be strengthened and create some active mobilization of the knee, especially in this position because your hamstrings will be stretched as well. When you extend your knee out, make sure you activate your VMO muscle. This will strengthen your knees and create active mobilization of the knee. Static knee extensions. This is definitely a tough one and it will test your flexibility. It will work on your hamstrings and strengthen your VMO. Try to keep your legs straight out and your knees locked in. And if you're really up to the challenge, lean against the wall and keep your back straight. This will create more of a stretch in your hamstrings. Stepping lunges. So these are a bit like static lunges, but you step with one foot after the other and you lunge each time. Try to have each knee bent at 90 degrees. This will build up your knee strength, VMO, stability and mobility as well. Lateral lower limb stretch. Stand against the wall. With your opposite hand, grab the opposite foot. Try to keep your legs straight as possible. If you're having trouble keeping your knees straight, this is an indication that you need to work on your hamstrings and your ITB and the TFL muscle on your lateral side, on the outside of your leg. Gradually work towards your whole leg being straight. This mainly works on the flexibility of the knee, and it's fantastic for post-surgery. Noodle stepping. Make sure the noodle is evenly balanced on one foot, then push the noodle down. Concentrate on contracting your VMO muscle. This will strengthen your knees and create mobility again in the injured knee. It will also work on the balancing knee as well, for example proprioception and strengthening. Noodle knee extensions. Have the needle evenly balanced around your furthest part of your shin whilst having your other leg nice and straight and supporting you. Now kick your bent leg forward almost to the point that it will go straight and then retract it back into a bent position. Concentrate on working your inner quadriceps. Once again, this works on your VMO muscles and your mobility as well. Knee pendulum swings. First try with a bent knee, and when you're ready, use a straight leg. Make sure the noodle is well balanced under your foot, and the resistance to the water will work against your ligaments on your knee, allowing you to focus on the muscles that will stabilize the knee. Sway it from side to side. Do about 20 of these. Box steps. Use a sinkable box. Use one foot to lead and step onto the box with the other one following. Then step over again with the same foot. Then do this backwards. An easier way to do this is simply just step up on the box and back down. Remember to use both legs. This will work on your VMO and the stabilizing muscles in your knee. Box side taps. By tapping on the side of the box, it will assist you getting up on the box. This exercise once again will allow you to build knee stability and knee strength on the inner and outer side of the knee. Standing on the wobble board. Just stand on the wobble board or pad with your legs straight and your knees locked in. Make sure you activate and concentrate on contracting your VMO muscle, which is the muscle just above your knee on the inner thigh. Try to keep balance for 30 seconds to a minute. This will work on proprioception, stability, and a little bit of strength. One leg squat. This is pretty hard to do, so leave it last. Balance on one leg and the other leg in front of you. Bend down until your thigh is almost parallel to the pool floor. If you can't do this, just go as low as possible and push back up again, contracting your VMO and your glutes as well. This trains your knee strength and balance. And if you're up to the challenge, try to keep the other leg nice and straight and in front of you, and point your toes and contract your other VMO on your straight leg. Squats on the wobble pad. Stand on the wobble pad and try to squat to the point where your thighs are almost parallel to the floor. And once again, if you can't, just go as low as possible. This will work on proprioception, stability and strength. This is fantastic for post-surgery or knee injuries. One-legged squats on the wobble board. Do this exercise last, since it's very hard. Try to keep one leg in front of you with your knee locked out and nice and straight. Whilst on the wobble board, try to squat as low as possible. Remember to contract the VMO muscle. This will strengthen the VMO muscle on each knee and the hamstring flexibility on the straight leg, and it will definitely challenge your proprioception on the bending knee. Flipper exercise is probably the hardest exercise of all them all. Let's start with flipper walking. Just walk with the flippers up and down the pool once or twice, and the resistance of the pool will work against your knees. And remember, focus using your VMO muscles. Try walking backwards as well, as these both will work on the strength of your knees, proprioception and stability. Kickboard with the flippers. The kickboard will allow you to stay afloat, hold a kickboard in front of you and start kicking. This is kind of like a repetitive leg extension exercise. And when you're ready, try doing it backwards. Remember to contract your VMO and your quadriceps and straighten your legs straight out with every kick. This exercise will gain muscle and mobility in your knees. Once these are too easy for you, try to do them without flippers. Then without flippers and a kickboard as well. Treading water with flippers. This exercise is very hard. It requires you to kick yourself to propel yourself into the surface of the water. You're also required to use your arms to keep balance by pushing the water back and forth. Do this for 30 seconds to a minute, 3 to 4 times. This will work on your mobility of your knees, your core, your buttock, your VMO and your hamstrings as well. Flipper kicks with your back against the wall. This is incredibly tough on the knees, since you're actually not moving anywhere, and the force of the wall will work against your knees as well. And remember to concentrate on working on your VMO and contracting those quadriceps. Try to do this slowly at first, and do it fast later on, otherwise you will tire yourself out. If this is too hard for you, face the wall, have your hands against the side of the pool, and then kick towards the wall instead. Noodle bicycle kicks. Depending how heavy you are, you can use 1, 2 or 3 noodles to sit on to keep you afloat. Once you're balanced, slightly lean back and kick your legs out in front of you. You will slowly move backwards. Remember, contract your VMO muscle, which is the inner upper part of your knee. Do 1 or 2 laps. Noodle walking. Balance each noodle on the bottom of your foot and start walking. Try walking backwards as well. Remember to push the noodle down with each step contracting the VMO muscle. This will work on the strength of your knees, proprioception and stability as well. Noodle side walking. This is very similar to the previous exercise. You can use the line on the bottom of the pool or the side of the pool to guide you along the way. Remember to walk back and forth from different sides. This will work on the inner thighs and the outer thigh muscles, which is very important to keep stabilization of the knee, especially pre-surgery or post-surgery, or even after injury. Pool noodle back kicking. Use 2 or 3 pool noodles, wrap it around you and lean back. This will help you keep afloat. Once you're balanced, start kicking. Try to extend your leg as much as possible with every kick. This will work on mobility and your VMO muscle. Do 1 or 2 laps. Guys, remember to check out my other pool video and also my other VMO exercise video as well.
Okay, so hope you have got some idea about hydrotherapy. So since like we will not be able to do this in person now, so I'll show you some more videos so that you get little good idea about it. Okay, for low back pain, actually it is not, you don't think this hydrotherapy is only for upper limb or lower limb. Hydrotherapy will give a very beneficial effect for the trunk, or you can say the core stabilization exercises. Okay, so it gives a very good relief for the low back pain, as well as it will help you to strengthen the complete core muscle. Okay, 1 minute.
Welcome back guys, I'm Nick from Active Chiropractic and I'm going to show you today how to do some low back exercises in the pool without any flotation devices. So it's really good to work in the pool because basically there's buoyancy, so less weight on your body, and there's dynamic resistance, therefore there's some resistance when you're moving, therefore you build up some strength. And obviously there's also hydrostatic pressure as well, so actually some pressure on the joints anywhere in your body, and therefore it actually decreases inflammation. Now, these exercises are fantastic because it builds the core around your lower back. That way, it actually prevents you from any more injury and also decompresses your lower back as well. so therefore less compression in your spine, therefore less pain. And it's fantastic to actually go see a professional before you do these exercises, because especially like a chiropractor, because they can actually decrease the compression there by loosening up the muscles and fix any malalignments there as well, and therefore reduce the pain. So for the first exercise, all you guys need to do is just walk in the pool. Now, if you're quite injured, just start off about 100 meters, and as you get stronger, work further and further away. What this does is it works against your abs and gives you a bit of dynamic resistance, so you get more strong in the core. And then move on to sidewalk. So you once again works on your core and works on your abductors and your glutes. So at first, just start on the rails, grab onto the rails. Once you're stronger, just let go and just walk from side to side. So this is knee curls. All you have to do is basically lean against the wall, grab hold of something and bring your knees towards your body. It works on your core and decompresses your lower back and therefore less pain. Make sure you guys are ready for this because it can cause you injury. Once you get strong enough, move on to your oblique twists. So when you do this, make sure you just twist your body, and if it causes you pain, stop immediately. It works on your obliques and obviously your lower back. These are elbows to knees. What it does is it creates a twisting motion in your lower back and a bit of flexion in your lower back as well, and it works on your core and your obliques. And this strengthens your core and therefore prevents your lower back pain, and also strengthens your lower back as well. As you get stronger, reach a bit lower with your fingers to your toes, and then works on your core just like the knees to your elbows. So these are just step ups, so you just step up on a block or step on the stairs if you don't have a block, and it works on your core, works on your glutes, works on basically the range of motion in your body, and gets you ready to start walking upstairs, step to the side as well. And it also works on your abductors and your adductors as well, so it's fantastic and prevent you from other injuries as well, and it works on your core, obviously from the dynamic resistance of the water. So these are leg kicks. All you have to do is just lean against the wall, grab a hold of something. It makes your body go into flexion, so less pain in your lower back, and it works on your core just by kicking and creating some sort of dynamic resistance against you. Once again, guys, thanks for watching, and if you want to do other exercises as well without a pull, try out these low back stretches or try out these low back exercises. Now, if you really want to support my channel, remember, hit subscribe, hit like. If you have any questions, comment below. I'll see you guys next week. Welcome back, guys. I'm Nick from Active Chiropractic, and today I'm going to show you some exercises in the pool that you can do with some flotation devices. Now, there's 3 good reasons why you should work out in the pool. There's static pressure is basically the pressure that the pool or the water pushes against your joints and your body that decreases inflammation. Dynamic resistance is basically the water working against you every time you move, so therefore building strength and building the necessary muscles that protect the joint. Now, these exercises are fantastic because if you are having an injury or need to go to surgery, pre or post surgery, these exercises will keep you mobile and also strengthen your joints and also limit the time for recovery. Kickboard oblique twist. Submerge yourself in water, stand with your feet shoulder width apart, and engage your core and engage your glute muscles. Now when you hold the kickboard, remember have your one arm straight and one arm bent, and obviously alternate as well. And do about 15 reps of this to 20 reps to 3 sets. Now the dynamic resistance of the water will work against the kickboard and obviously strengthen your core muscles, which is your transverse abdominis, your oblique muscles, and your rectus abdominis, which is very important to protect the back. These are kickboard pushes, so basically just have your feet shoulder width apart, hold on to a kickboard and push back and forth. And what it does is have the water have dynamic resistance against your body, therefore strengthening your core and therefore strengthening your back. Do about 15 to 20 reps of this, 3 sets. So these are pool noodle bicycle kicks. Now why I'm using the wall is because this is a beginner exercise, so you can lean against the wall and have a bit of stability. And what it works on is basically your knee muscles and your core as well, and therefore working on your core, you will strengthen your back. So do about like 30 reps of this, or maybe 40 reps if you're really enthusiastic, and do about 3 sets of this as well. You can use 2 pool noodles or 3 pool noodles. So mermaid kicks with the pool noodles, you can use 2 pool noodles or use 3 depending if you're having trouble with floating or not. Just do about 15 to 20 reps of this, 3 sets. And it basically works on your core and strengthens your core and strengthens your lower back. It also works on your knees as well. These are pool noodle oblique twists, so basically keep your knees together and twist back and forth, and that basically works on the oblique muscles of the core, and they're essential to strengthen the lower back as well. Now if you have trouble actually floating like me, I probably should have used 3 pool noodles instead of 1, and just do about 15 to 20 reps of this 3 sets as well. So these are pool noodle kickbacks. Basically just use 2 pool noodles to help you float, and if you're having trouble to float, use 3 pool noodles instead. And the act of actually floating is actually engaging your core and strengthening your core, which is very important to strengthen your lower back. Now it also works on your knee as well, don't forget that. Now if you really want to actually kick more efficiently, point your toes, push your hips up, and you actually go a lot more faster. Maybe try to do 1 lap of the pool, then after 2 laps, and then when you're confident, just keep going and keep going. And this actually works really well. Standing dumbbell flies. So basically you hold 2 dumbbells from side to side with your arm extended and locked in, and then just have your feet shoulder width apart and go back and forth. Now this works on your core and also your chest muscles as well, but with the dynamic resistance it actually works against your core and therefore strengthening your core and strengthening your lower back. Do about 15 to 20 reps of this, 3 sets. Now if you do have trouble actually standing still because the dumbbell flies actually cause you to move quite a lot, just have 1 foot forward and 1 foot back, and you will find yourself more stable by doing this. So these are dumbbell punches. Basically just have your feet shoulder width apart. Now if you find that you're quite unstable, just have 1 foot forward, 1 foot back, and then just punch back and forth. And what this does is basically work against your core, because there'll be heaps of dynamic resistance working against you, and there'll be alternating forces from either side. And this will also work on your chest muscles as well. So do about 20 reps of this to 30 reps, 3 sets. These are dumbbell lateral pull downs, so basically just stand shoulder width apart, and you'll find that the force will be pushing up, so have your elbows locked in and then push down. And this basically will try to lift you up, but the thing is, if it lifts you up, therefore you have to engage on your core, engage on your glutes, and therefore working on your core muscles and strengthening your lower back. 20 reps of this to 30 reps, 3 sets. Flipper kicks, so basically just lean against the wall and then basically just kick back and forth, like just a bit like the bicycle kicks as well. And then this works on specifically on your VMO and your knee muscles, but also your core as well, so don't neglect this. If you can find yourself a pair of flippers, give this a go. Do about like 20 reps to 30 reps, which is quite tiring, to 3 sets of this as well. Once again guys, thanks for watching. Now if you do have low back pain, please go see a chiropractor and get examined properly and get treated properly. Check out my other video in the pool for low back pain, and also check out my 4 core exercises as well. Now if you really want to support my channel, remember hit like, hit subscribe. If you have any comments, comment below and I'll try my best to reply to them. I'll see you guys next time.
Okay, so far we saw some spinal exercises. So I'll show you one more video of upper limb and lower limb. Then we will finish up the class.
Call the number below in order to schedule a self-pay pool session or an appointment with a therapist. In this video, we will be focusing on the upper extremity. We will be using TheraBand, paddles, a wand, and a kickboard for different resistances underwater. The first exercise will be external rotation of the shoulder with a TheraBand attached to the ladder. Keep your elbow at 90 degrees and make sure it stays pinned to your side. From here, you can move the TheraBand down on the ladder and work on overhead external rotation of your shoulder. At this point, both your shoulder and your elbow should be at 90 degrees as you are pulling the TheraBand back as far as you can go into external rotation. While keeping the TheraBand in the same hand, turn and face the opposite direction for internal rotation. Make sure your elbow stays pinned to your side as you bring your wrist across your body for internal rotation. Next, use an underwater dumbbell for an elbow press down or a tricep kickback. Keep your arm to your side, then bend your elbow to 90 degrees, then press back down. Here is an example of a paddle that we will be using for the next couple of exercises. You can open and close the ends to add or take away resistance. Start with your arms straight to your sides, keeping your elbows straight. Pull your arms up into abduction and then back down into adduction. Next is the same idea, but your arms will stay straight out to the side. Bring them together in the middle and then all the way back out. Next is stationary trunk rotation. Stand either with your feet shoulder width apart or staggered for better balancing. Put your arms straight out in front of you and rotate only your trunk and arms from side to side as far as you can go. Once that exercise becomes easier, add in a paddle to add more resistance. Remember, you can open and close the ends. Open is less resistance and closed is more. This next exercise, it's easier to stand against the wall in order to stabilize you. Hold a kickboard in front of you and push your arms all the way out until they're straight and then bring it back again. Turn around and hold the kickboard behind you. Try to straighten out your arms as far as you can get them and then pull the kickboard back towards your body. For the last exercise, we'll be using a wand or just a skinny PVC pipe. Here she is focusing on her left shoulder's internal rotation. She's holding the wand above the water with her right hand and pulling her left arm up. Switch arms and complete on the opposite side.
Easy for her at this point, but it's just a good
shoulder exercises. Okay.
One other thing that we had done in the beginning too was just some noodle push downs in the front and at the side. You want to just show a couple of those? And those are really very easy for her at this point, but it's just a good beginning exercise too. We also, her first couple sessions, we did do a little bit of walking on the treadmill the first 1 or 2 times just to work on some arm swing, but she quickly advanced past that. So just getting the gait back, getting the swing, not compensating for, for a lot of people, not so much in her case, but people tend to really guard that arm and hold it up close to their body. So it works well just to work on some swing. So in the beginning, many times that noodle offers a lot of resistance to people, especially when you're using it just on the involved arm for up and down. Oh, I know what else to do, Shelly, behind you, with 2 hands behind. Gets a little internal rotation stretch again, too. It's the beauty of the pool. You get a good workout to all the other muscle groups, too, not just that shoulder. Legs have to stabilize you, and the stomach muscles. So those are just aqua fins. Yep, so just start with... This is more strengthening. And just having her focus too on her scapula movement and trying to make sure both sides are equal has been a big key. When we first started, she definitely did more substitution, a lot of shoulder elevation. So she's improved quite a bit from the first visit. Really keep that elbow at your side. This one's tough. This is just trying to work on external rotation, and as you can see, she tends to let that elbow come away from her side. And then Shelly, you can switch to those diagonals. Just really coming down to that. Try to really actually come down to your opposite hip. And then these were the ones where we added your head to turn with your arm, just to get some cervical range of motion in too, because so many times the upper trap and levator gets tight as I really turn the head this way too. Like when you're down, turn your head all the way. There you go. Good, and then try the opposite too. So when your arm's out here, there you go. Just getting opposite
stretching those muscles. All right. Well, I know we did the 8s too, figure 8s. Good. All right. So why don't you take those off? Do that little hip stretch this way. So just to stretch into internal rotation, adding that Hydrofit cup just adds that little bit of buoyancy. So just try to stretch it back there, Shelly, and hold it. To be so careful for compensation. I mean, people tend to really like flex their wrist or extend. And now, when we first started, I think she could barely get to your butt. Yeah, so that's really some nice progress. Yep, grab a noodle. And we'll have you just first do like the snow angels. Up over your head. So just some supine floating to work on. Oh, she's going to lock her feet in the side so she stays still. That helps. So just to work on some ab and adduction. And again, just focus on it gets the scapular muscles engaged again, and then work your started. She definitely did more substitution, a lot of shoulder elevation, so she's improved quite a bit from the first visit. Really keep that elbow in.
This is called as aquafin. Can you see it in her hand? This is called as aquafin. Okay. This is noodles.
Exercise too. We also, her first couple sessions, we behind. Gets a little internal rotation stretch again too. It's the beauty of the pool. You get a good workout to all the other muscle groups too, not just that shoulder. Legs have to stabilize you and the stomach muscles. So those are just aqua fins. Yep, so just start with this is more strengthening. And just having her focus too on her scapula movement and trying to make sure both sides are equal has been a big key. When we first started, she definitely did more substitution, a lot of shoulder elevation. So she's improved quite a bit from the first visit. Really keep that elbow at your side. This one's tough. This is just trying to work on external rotation, and as you can see, she tends to let that elbow come away from her side. And then Shelley, you can switch to those diagonals. Just really coming down to that. Try to really actually come down to your opposite hip. And then these were the ones where we added your head to turn with your arm, just to get some cervical range of motion in too, because so many times the upper trap and levator gets tight. As I really turn the head this way too. Like when you're down, turn your head all the way. There you go. Good, and then try the opposite too. So when your arm's out here, there you go. Just getting opposite neck motion, stretching those muscles. All right. Well, I know we did the 8s too, figure 8s. Good. All right. So why don't you take those off? Do that little hip stretch this way. So just to stretch into internal rotation, adding that Hydrofit cup just adds that little bit of buoyancy. So just try to stretch it back there, Shelly, and hold it. To be so careful for compensation. I mean, people tend to really like flex their wrist or extend. And now, when when we first started, I think she could barely get to your butt. Yeah, so that's really some nice progress. Yep, grab a noodle. And we'll have you just first do like the snow angels. Up over your head. So just some supine floating to work on. Oh, she's going to lock her feet in the side so she stays still. That helps. So just to work on some ab and adduction. And again, just focus on, lots of times too, I'll get in the pool with somebody and just feel their scapula to give them that feedback of how those are moving. So just working on the symmetry of that. I would say if somebody has a shoulder injury and gets in the pool, if they don't want to get their hair wet, they aren't going to reap the full benefit of the pool. And same thing with if they're willing to learn to use the snorkel and mask, it makes a tremendous difference in their progress. Because as you can see, if you work just in standing, you pretty much can get to 90 degrees, and that's it. The other one were those clocks. So if you start down here, just get those shoulder blades, so you're just kind of pushing down. Just working on, again, just some scapular strengthening. So it's just, I call it a supine clock exercise. If you start with your arms down at like a 6 o'clock hour and just work on pushing down into the water, it gets the scapular muscles engaged again, and then work your way up to the 5 and 7 o'clock and do the same thing. And it gets progressively harder as you work up to 3 and 9 and then way up to overhead. Repetition, people tend to fatigue with this a little more quickly. The other thing, let's see if I can get these. So the bells just add a little extra level of resistance too. So Shelly, with these, just keep those palms up, and it's just that same, actually think of pushing the bells right down to the bottom of the pool. Not literally, but that's the motion. So that just adds that extra bit of resistance. And again, with that, you can start at that 6 o'clock with your hands down and just progressively work on going up. And it definitely is much harder the higher up you go. And it just gets those middle traps, lower traps, rhomboids. See, and you can see definitely with her right arm, it doesn't go quite as well as the left. All right, why don't we do that mask and snorkel? So actually, before I would show anybody the mask and snorkel too, usually we go over, I would start them first with the mask and snorkel on and just doing a little bit of squatting to get used to the breathing if they haven't done that before. Also work with them on how to get back up once they're in this lying down position, because sometimes people get in that panic mode. Many times I'd be in the pool with them the first time that they did this. So what she's starting with now is just a little bit of stretching. Just slow that up a little. Yeah, there you go. So just kind of pulling in for a little rest and then stretching out, hanging on to the side of the pool. Shelley, you can hold it a little more. Yeah, stretch right out there and hold it. And again with this, the snorkel and mask just puts the neck in such a much better position and alignment. If she were lying like that, and her neck would be really almost hyperextended. She can say that's a great stretch. She was not able to tolerate any of this on land. Was just almost impossible. Just from a pain standpoint, she got in the pool and was really able to move. All right, and then what we also did, we kind of held down this way, and then you can also stretch with the hand on a little more external rotation to get a little combination of external rotation and flexion stretch in that same position. So yeah, if you want to turn around and just hook your feet in there, and then range of motion wise, the snorkel mask is another great way to work over 90 degrees. So just working on, start with that flexion, yep, so coming up, and then the snow angel type of movement. just changes that stretch of the shoulder again. So here's just getting a little more external rotation. Also, again, just working a little more middle trap. So as you can see, it's a little harder for her to get up to 90 degrees because of the lack of external rotation. You can do a nice stretch here too, again with that Hydrofit cuff for external rotation. So just getting into that position and holding the cuff. Just letting the buoyancy pull, yes. Again, in this position, lots of times people need cueing to just make sure to stay looking down at the bottom of the pool. If you start looking up, again, your neck just goes into that extension position. But to me, this is the way the majority of the patients that I treat with shoulder problems have made the best progress. The other one I was going to do was the barbell, those push downs with that barbell. So just do the straight push downs, like right at chest level, and then you can also do the stretch where you bring it up overhead and pull down. In this, you might start with just a noodle, a little less resistance. And many times people will really feel the difference in their involved side doesn't have as much control. So it just really works great for progression of control of that. And it's been nice to be able to get your feet to lock right in there, because then people can just focus on true shoulder movement versus moving all over the pool. So again, with the all the range of motion that we did, we showed that with no extra resistance, but you can progress to using the gloves, the aquafins, you can use the hydrotone bells or the barbells, all for extra resistance. Let's just show that rotation stretch too, Shelley, with the mask and snorkel. So just taking this again and laying down kind of in this position. Not so much back, but more if you're here, remember just coming out into this position. So you get that stretch into the rotation. And then you can, come up into the internal rotation too. And then just, try to bend that elbow a little bit more. There you go. So that's that external rotation stretch. And then in the beginning, you may have to get in to just help stabilize that shoulder a little bit, just because of the way, like, especially for her, her injury was over a year ago, so all that learned compensatory strategies, like, she's really unlearned a lot of those by being in the pool. I think that's the piece that I find the most, is that people get in and they can really not compensate as much because of the, they're usually such much less pain. And then she tries to get into that internal rotation, which is, again, that's just such improvement for her. Make sure that hand stays, yes, because what people will do is just that. They'll cheat with their wrist because they feel like they're getting more motion. And someone like her, I believe it was this side that she had some carpal tunnel surgery on, so you want to be especially careful. Started using the jets for a little more resistance to just some push-pull work.
Okay, so this one is the to create the turbulence. So yesterday in the theory class I said, right, to increase the viscosity, you need to increase the speed of the water. So once you increase the speed of water, the resistance also will be increasing. Okay, so this is the not this yellow color. You can see here they have increased the speed of the water.
was just that push down and pull up too now. And then just, Shelly, if that's easy, remember the faster you go, the more resistance you get on the push down and pull up. And then that other, do you remember that rotation one? So you just pull the board here, rotate, and then just extend that back arm out, rotate, and just rotate all the way around. There you go, and then switch. You can also use a kickboard for these exercises too. You can try those the rotation ones too, Shelly, with the elbow locked right at your side. Over the, yeah, it's not there, but try to keep that elbow right in. There you go. There and hold with two hands, and I think you did two-handed pullbacks. Well, here the pullbacks is just more scapular. Well, and you could, when you do the dumbbells, like the push-pull, you still on the pullback, you definitely get that whole scapular motion too, strengthening. And we do have her. So Shelly, go ahead and turn around, and we did pull forwards too. So just really too getting those muscle groups working in all different directions. It's just a little more protraction, retraction motion again. So just really keep that elbow straight on those, Shelly. So it's just all the movements really coming from that shoulder and shoulder blade, especially on that pull back. There you go. The tendency is to want, because it gets so tight, the tendency is to want to bend that elbow again for making you feel like you're moving more. This exercise is usually really hard for people. The next piece is to turn palm up, so you get more external rotation. Because you really have to use your shoulder to do that correctly. The other one was just thumb down, so it's a little more internal rotation. That wrist strength.
Okay, so let me show you one more video for abdominal exercises. Okay. Okay. See, now like what you are supposed to do is you can take the muscles from shoulder, then you have to think what would be the position for assistance buoyancy, resistance buoyancy, and counterbalancing. So in the exam, it will be like they will be giving you a case scenario and they will ask you to write the assistance, resistance, and the counterbalancing. Okay, so all three. So for example, for the muscles for which you have muscle power 2, you have to go with the counterbalancing buoyancy, and for the muscles who have muscle power 3, then you can go for the resistance. So the muscle power less than that, you can go for the assistance. So that kind of case scenario only will be given in the exam. So from now on you can start preparing for the shoulder muscles, and like slowly from all for all the muscles you can prepare and keep it ready. So you need to write what will be the position of the patient, where you will put the buoyancy belt, then what is the procedure. Okay, so you can just put position of the patient, buoyancy belt, and how you will be doing assistance, counterbalancing, and resistance. Is that clear? So you start preparing now itself, so that when we are discussing the case scenarios, then it will be more useful for us. Okay, so I think like most probably by tomorrow you will be getting the LMS link. Once it is registered, then I will upload all these videos and the slides. Is that clear?
Yes, miss.
Yes, miss.
So far, do you have any doubt?
No, miss.
Okay, so
Fine, no, miss.
you need to what you need to do is like you don't just merely watch the video. So I showed different types of videos so that you get an idea how to do the exercise. Okay, so you watch it slowly and see what muscle they are doing and how they are doing. Okay, so in case if they are doing an assisted position, then you have to think what will be the assisted position for that particular muscle. Okay, and what will be the stretching position for that particular muscle. So all these things you have to if you keep it ready, then it will be easy when you are preparing for your exam. So is that clear? Hope you will do so. Once the LMS is ready, then it will be easy for us to upload. Then you will get an idea from the handbook also. Okay, meanwhile, I can also send through the WhatsApp the tutorials and the case scenario so that you can start preparing for the tutorial class. Okay, so thank you all. So see you tomorrow. Okay, tomorrow also we will have class. Okay, thank you.
Thank you, miss.
Thank you, miss.